Hi friends, welcome back to Agape Vlogs. This is a new series on DHA Prometric nurse exam. Actually, this is a requested one. We have been following NMC CBT exam questionnaires and we'll continue on that very shortly. But you can follow Agape Vlogs if you are taking your nurse's exam anywhere in the world. I assure you that it is a universal syllabus and these questionnaires will enable you to attend and crack your exams wherever you are. Okay friends, let's start with the first question. Which of the following reacts to viruses and bacteria by increasing in number? Option A, antigens. Option B, antibodies. Option C, platelets. And option D, Rh factors. So it's a simple question in fact. And it's of course an important question. So have you guessed the right answer? Please do keep guessing the right answers and also please do mark your scores. And towards the end you can find out where you really stand. Okay, the first answer is option B, that is antibodies. So moving to the second question, when is the best time to collect urine specimen for routine urinalysis and culture and sensitivity? Options are option A, midnight, option B, early morning, option C, before breakfast, option D, later afternoon. I know all of you have got it right. Option B, early morning is the right answer. Okay. So let's go on to the third question. 3 days ago, a patient had an invasive surgery with an open wound. The patient is febrile with drop in blood pressure. Lab test result shows elevated WBC count. This could be possible presentation of. Options are option A, excess fluid volume. Option B, internal hemorrhaging. Option C, atelectasis. Option D, sepsis. For your information, atelectasis is a complete or partial collapse of a lung or a section or lobe of a lung. Atelectasis is one of the most common breathing respiratory complication after surgery. And there may be no obvious symptoms of atelectasis. When symptoms occur, they may include trouble breathing, cough, and low-grade fever. Furthermore, what is sepsis? Sepsis, as you all know, it's a life-threatening complication of an infection. It occurs when chemicals released in the bloodstream to fight an infection trigger inflammation throughout the body, and it can cause a cascade of changes that damage multiple organ systems and leading them to fail. Sometimes even results in death. So now we have learned once again what is atelectasis and what is sepsis and what is the right answer to the question. The right option is option D, that is sepsis. No doubt the answer is sepsis because the sepsis symptoms include fever, difficulty breathing, low blood pressure, fast heart rate, and mental confusion. So I believe it is very clear to you. Now let's move on to the fourth question. A pattern in which the nursing personnel divide the patient into groups and complete their care together is called. Options are option A, nursing manager care case method. Option B, primary method. Option C, none of the above. Option D, team nursing. So what's the answer? Option D, team nursing is the right answer. Got it? Next is a very simple question. When describing dizygotic twins to a couple, on which of the following would the nurse base the explanation? Options are option A, sharing of a common chorion. Option B, 2 ova fertilized by separate sperm. Option C, each ova with the same genotype. Option D, sharing of a common placenta. So what is the right answer here? The right option is option B, that is 2 ova fertilized by separate sperm. So if you have found my video useful, before continuing, I have a small request. Please don't forget to give a thumbs up. Next question. A nurse scheduled a patient for a surgical procedure to take place in 1 week. When would the nurse most likely implement surgical education? Options are option A, start during this visit, option B, after admission to the hospital, option C, after the operation, option D, immediately prior to anesthesia. So the right answer is start during this visit. Seventh question, a newborn is diagnosed with respiratory distress syndrome. Which position is best for maintaining an open airway? Options are side lying with a towel beneath his shoulders. Option B, supine with his neck slightly extended. Option C, prone with his head turned to one side. Option D, supine with his neck slightly flexed. The right answer is option B, that is supine with his neck slightly extended. Next, a very important question. Question number 8. A health worker is referred to the nursing office with a suspected latex allergy. The first symptom of latex allergy is usually, options are option A, swelling and itching of the hands, option B, difficulty in breathing, option C, oral itching after eating bananas, option D, swelling of the eyes and mouth. So what is the right answer? I would like each one of you to comment in the comment box the answers. Okay, let's move on to question number 9. The nurse is aware that the most common indication using ECT is, options are option A, bipolar, option B, anorexia nervosa, option C, schizophrenia, and option D, depression. So what is the right answer? What is ECT, by the way? ECT is electroconvulsive therapy. So it is the most effective treatment for depression. It is also used to treat other forms of mental illness. So here the right option is option D, depression. Here in this question we came across 4 psychological disorders. The first one being bipolar disorder, which is also called manic depression. And what is it? It is something everybody knows. It's a disorder associated with episodes of mood swings ranging from depressive lows to manic highs. Next psychological disorder here in the question was anorexia nervosa. It is an eating disorder causing people to obsess about weight and what they eat. Next psychological disorder we found in the question was schizophrenia, which is characterized by thoughts or experiences that seem out of touch with reality. It is a kind of disorganized speech or behavior and decreased participation in daily activities. Okay. Before going to the last question, let me remind you to subscribe if you haven't, and those who have already subscribed, I'm really grateful to each one of you. And also do click the bell icon so that you get the notification each time I do post a video. And I also sincerely hope that you will be commenting on the 8th question. I am looking forward to the answers of the 8th question. Okay, let's go on to the 10th question. This is also an important question. A nurse is admitted to the medical unit with the diagnosis of fluid volume deficit. What would the nurse expect the doctor to order? Options are option A, dextran in normal saline, option B, 45% sodium chloride, option C, 5% sodium chloride, and option D, 9% sodium chloride. The right option is 9% sodium chloride, that is option D. Those of you who are going to take your exam, please also listen to the other nursing questionnaires which I have posted earlier. It will be very useful, and I will be coming back very soon. So please click the bell icon and please share with your friends. Keep yourself safe. Take care. Bye bye.